The operation interface on the touch screen. The animal's abdominal cavity needs to be inflated in CBCT. Then need to use the respiratory suppression technology as the built-in ventilator to reduce motion artifacts and obtain clearer images. Press Start. The machine starts to inflate the animal. We can hear the sound of inflation and the ABC mode. When the animal is undergoing CT scanning, it inflates to animal for 4.5 seconds before returning to normal. Then, the setting on the right corner can set the respiratory rate, inspiratory pressure, and inspiratory time. The normal time setting is 1,500 milliseconds, and the max value is 2,000 milliseconds. It is 2 seconds, and the mean time is 500 milliseconds. And the value of inspiratory pressure, usually set between 15 to 20, and the max value is 40. Value of 20 for large animals is okay, and 15 for small animals, like cats. We set the normal value 1,500 milliseconds. We come to see the max value. $60. General set the respiratory rate to 8 to 10. A little fast for 15. OK. Return to the main interface. Next, we come to see the laser light. The red laser light, and also can see over those two sides. One horizontal and one vertical, like the cross. Well, come to see the control system of table. Raise the table. Long pressing the raise button. See the table is slowly rising up. Long press lower to lower the table. OK. Press advance to push the table into the arm. Long press retract to push the table out of the arm. Press the couch reset to reset the table back. OK, come to see the position. CT position. After press it, the table lifts up. Raise the table to be aligned and parallel with the laser lines on two sides. Drive position. Press it and the table lowers down, but not to the bottom of the arm. There is a gap between the table and the bottom of arm. OK. There are several segments on the table. 1 to 6, total 6 segments. -1 segments correspond to the 6 areas here. Press the number 1. We can see the horizontal laser posits on the segment 1. Press the number 3. The horizontal laser posits on segment 3. Let's see it. The animal's mouth almost corresponds to this area. Number 2 corresponds to segment 2. Next, come to see the specification, voltage, current, and exposure time. Focus can adjust the values in software. Select the angle of gantry. In fluoroscopy imaging mode, it needs different positionings. to scan the fluoroscopy images. Can adjust the angles by yourself, or choose the recommended angles below. That's for recommended angles. OK, switch to DR or CT imaging modes. Need to reset the gantry. Press the 0. The gantry resets back automatically. Also, we can see the change of angle by the changes of the laser light. Angle of 90 degrees. See the laser light. Here it reaches the position of 90 degrees. Press 0 to reset back. OK, finish the introduction.